Welcome back. I have a lot of patients that ask, what do we do when they have a cavitation? How do we take care of that? So I want to share with you a little bit about what to expect when you have cavitation surgery done. So like we explained a little earlier, a bony cavitation is an area in the bone that didn't heal correctly. So I do have to be able to get to that area in the bone. So it is a surgical procedure. I move the gum out of the way, and then I'm able to get into that hole and discover what's inside. A lot of times it's kind of crazy. I tell people it looks like salad dressing because it literally has oil coming out of that hole. As that bone dies, it becomes what's called fatty necrosis, and fat is oil, and it looks like oil. So I always know when we found the area, that oil starts bubbling out and we clean it out really well. But then what we do after that is the most important. So sometimes I can't get into every nook and cranny that hasn't healed, and there are some big nooks and crannies that I've found. So I use a few different things to clean that area out. First of all, I clean it out just with an instrument. You know, I feel around and make sure that there's nothing that I need to get out of there. That's the first thing I do. Then we use ozonated saline. Ozone is extremely powerful. One molecule of ozone is more powerful than 3,000 molecules of chlorine. It kills every bug in sight. It's amazing. So we use saline that has ozone incorporated into it, and that way it can wash down in that whole area and clean everything out. Then we step it up even further and we use ozone gas, because that gas can infiltrate into every nook and cranny that there possibly is. In fact, sometimes when we're doing cavitation surgeries, people will feel it elsewhere. They'll say, oh, I feel it back here in the back of my head, because the infection that was coming from that area had extended clear back there. So the gas will get all the way back in there. Then we use a laser, which also extends some energy down in that area and cleans it out. And then the best part of all is what we fill it with. After we feel like it's 100% clean, we fill it with what's called PRF, or platelet-rich fibrin. Now, this is something that you do need to expect before you come for your appointment, because we're going to draw your blood. We know that whatever comes from you, your body is going to accept better than anything we can put in that's synthetic or from a cadaver or anybody else. So we draw your blood, and we have a special procedure that we do that actually takes the fibrin from your blood and creates these little fibrin mats. We press those till they're thin little layers. We call them pancakes, and we actually stack those pancakes inside of that cavitation hole. We then close everything up with usually only takes about 1 or 2 stitches, close it up, and you get to heal. That fibrin, because it's yours, it enables your body to actually heal for the first time after that extraction was done. If you choose, we can also biopsy at that time. Some people really do want to know what's living in those holes, so we can do a biopsy at that time and let you know what is happening, what's living down in there. So let us know if that's something additional that you would like to have done at that appointment. That's what you can expect when you're having cavitation surgery, and we're good at it. We do it almost every single day in our office. So it's something that you can feel confident and comfortable about, but I wanted you to know what to expect.